We are joined now by Asrar Kayyal. We're really pleased to have her on the schedule. So Asrar is a researcher in community psychology and works as an educational psychologist. And we are incredibly pleased to be able to hand over to you, Asrar. Anyone who has any questions for her, please do post them in the chat box, and we will have a Q&A session at the end of her presentation. So please do post any questions you want me to relay to her. Asrar, over to you. Thank you so much for joining us.
Thank you all for this great effort for UK-Palestine. So today, as we are gathering in UK-Palestine to commemorate the 73 years on this continuous Nakba, we are surrounded by the scenes of martyrs wounded and arrested all over colonized Palestine. And whereas I see psychology as a tool to liberate people as individuals or communities from the burdens of their unconsciousness, repression and deprivation, in addition to building their capacities, I found this as an opportunity to speak about examples and characteristics of the psychological services provided in colonial context, and to discuss with you whether they are achieving this aim or being added to the other fields that reproduce the oppression and the colonized of the colonized Palestinians. Sorry for, I'm starting with apologizing about my English, so I will be reading a bit, but if I wasn't clear or so, please just stop me and let me know. So I'm an intern educational psychologist and researcher in community psychology. My family comes originally from Al-Birwi displaced village, which was displaced in 1948, and we were banned to return to the village. Where years after they established, like the Israelis established the Ahyahud settlement on our lands. I was raised 5 or 6 kilometers away in Kufr Yassif village, where I am sitting today, in the Galilee area, where are many clashes happening outside and many arrestments. Which means that each day I go to work, passing by the settlers, enjoying our lands while we are paying rent for living in a small apartment. And though I'm currently, like in the couple past years, living in Jerusalem, in East Jerusalem area, doing my work and internship there. So in commemorating Nakba, each year we internally displaced, we are used to visit our displaced village. Our village is like more than 500 displaced villages. We all go there and commemorate Nakba. And though the settlements has gates and guards, we usually wait outside till one of the settlers opens the gate to go out or in, and then we just sneak and enter fast. The same when we go out. But today, as according to what is happening in the lands occupied in 1948, the settlers armed attacks on Palestinians in the streets and in the neighborhoods of Akka, Lid, Haifa, and Yafa. So we just couldn't visit our village this morning. So as I said, I studied psychology from a personal interest in human self that turned afterwards to be a belief, to a belief in psychology as a tool to liberate individuals from the burden of the unconscious. till I touched the reality that the field and the actual personal experience put against my eyes and my conscience that cannot actually be a part of my professional conscience. The belief that the values of our code of ethics definitely help us as professionals to provide good enough quality of interventions added to our maybe patient in what we do. But the important question we should ask here is how to keep this code of ethics in unusual context or colonial context. And is that applied everywhere, even in the case when the value of preventing harm contradicts with the essence of the system that the intervention services are provided through, as Nadira Shalhoub-Kevorkian asks in her article on social work services in East Jerusalem. We have been taught that psychology and psychological care provided should be neutral and apolitical, while the main contradiction that the field brings, especially in colonial contexts, is that political reality, conditions, and practices are forming the psychological selves of both individuals and collectives. We may speak about different implications of the Nakba and the continuous Nakba on the Palestinian self, as Fanon, Mustafa Hijazi, and others spoke deeply about the implications of prolonged oppression and colonial, uncolonized individuals and collective selves. Implications that the educational, health, mental, and psychological care fields do not take into consideration while providing their services, and instead using the same American Eurocentric standards for the interventions of diagnosis and therapy. Me, as psychological services provider, when describing or pointing this complexity to my colleagues of what mental health in colonial context and political colonial nature, I face in many occasions the accusations of being unrealistic and living in denial of the system, because I am part of the system and should be part of its practices and apply it. This condition where people fear of putting because I think that they actually fear facing this condition where people have the fear of putting their own definitions and measures to things and keeping to stuck to and related to the colonial standard was described actually by Fanon in The Wretched of the Earth as one of the mechanisms that the colonized self will be trained to and formed around the centrality of the colonizer, while Paulo Freire described it as the fear of freedom. And I couldn't actually miss the chance of not reminding my colleagues about that when the municipality of Jerusalem, as the employer of the psychological services, has sent us employees an invitation to celebrate the Uniting Jerusalem Day, which for us Palestinians means the commemoration of the occupation of Jerusalem, or the annexing actually, which is banned by the international law. They finalized their letter in greeting us, wishing that our day continues to be blessed and hopes for us a happy uniting Jerusalem Day with 3 exclamation marks actually. You know, if this was only an one exclamation mark, I wouldn't really care, but we learned at school when there are 3 marks, so there must be an important issue that needed to be cleared. And this, for us, this sound as like a threat or so. So let me share with you now different cases from work field of educational psychology that elaborate more the complexity of providing psychological services in colonial context. So first example is when I sat once with this mother for an intake and where her daughter, like 8 years old, has learning difficulties, mainly in language and in reading. And when I asked her about the developmental history or anamnesis, she described a girl with speaking difficulties till 5 years old, and added, after several clarification questions from my side, I know that she said, I know the conditions weren't in favor of this girl, and I couldn't be there for her. We didn't know the reason of that delay, because most of the time I cannot go out of house because I have no Israeli permission of stay here. We have submitted a family reunification demand, but they kept us waiting for years now. Once I took her to a doctor. We went to see to a speech clinician. On our way, a police stopped us and asked for ID. When I said I do not have it, he threatened that if I show up again in Jerusalem streets, they will kick us behind the barriers, and said that the police can get to any information and can find me all the time. So I better stick to the West Bank. And this happens when simply the wall was built. The separation wall was built between Jerusalem and the West Bank, just separating many thousands of families from both sides of the wall. Since that time, since that day, I didn't go back. We went only for emergency medical help, so their father can take a day off work to take them, the girls, to the doctor. Later on, after she speaks about her experience running away of the police when they come to their village, even if she at home, she describes herself not being able to look out of the window. She asked, crying at the end, do you think the girls are noticing this fear of mine? Do you think this affects them? Actually, this woman, this brave woman, could actually be brave and speak about her own fear, and suddenly realized how her own fear can be actually transmitted to her daughters. And she spoke about how she couldn't just take a girl with 5 years like delay in speech for till 5 years old, and couldn't take her to the doctor because she couldn't just get out of home. The second example that I'm speaking about is the psychodiagnosis tools. Most of the psychodiagnosis tools we were prepared in Europe and in the US, while the Israeli colonial regime, as a part of its establishment and vision, consider itself European state. And they are actually importing these tools of diagnosis and translating them into Hebrew and Arabic for the Palestinian use inside Jerusalem and the lands occupied in 1948. Sorry, do you have me?
Yes, you're there, no problem. Carry on.
Yeah, thank you. These tools may sound sarcastic when they try to check general knowledge of Palestinian kids. When they, for example, ask to evaluate these kids' ability of logical thinking and problem solving via questions that ask who they turn to in case of emergency, robbing or fire, and expect kids to give an answer like the police. While for Palestinians and Palestinian kids, Israeli police is perceived as the factor that causes damage, kill Palestinians, arrests kids, and beats their family members in front of them. So when kids do not turn to police and do not give us this answer, are they considered as acting out of the system and as naughty or riotous kids? Many times outside of my work in the public services in Jerusalem, but through the private or volunteer work I do, I face many children, no matter how smart and intelligent they are, they tend to destroy exactly everything they do, they create. Whether this was in clay or painting. And actually, this is during the therapy meeting. And no matter how beautiful this the thing they created was beautiful, and not long time passes till I realized that I simply cannot allege that their specific predicament now is not directly related to the fact that they have no ID or have no registration at all. And this is part of the Israeli policy of to evacuating Jerusalem from Palestinians via refusing to register newborn Palestinians in several cases. The spoken and the unspoken say of "I do not exist" is accompanying the whole experience, and unfortunately, it has realistic and objective resources, and it's not only in their heads and minds. It's not a subjective say. What I allege that the academia that produce knowledge in therapy, psychology, and other sciences is actually reproducing oppression and alienation to the colonized self by the therapy and the psychological services. This might be via adopting the fragmentation in the Palestinian community that Israeli colonial regime tried to make. Actually, this fragmentation between Gaza, lands of 1948, East Jerusalem, and West Bank. When try to approach knowledge from other places in the world, we Palestinian professionals are facing the demand to sell our case as a product of research or in order to get funded, which is like, as David Harold already said, which is like replacing the natural and human reaction of rage and refusal towards injustice and oppression into making plain syllable and answers the European criteria as regarding our practice of the profession in the Israeli, via the Israeli services and academia. The Israeli academia mostly produce our knowledge as Palestinian professionals in East Jerusalem and in the lands occupied in 1948. We can speak about the example of the commemoration of Nakba, which is today. While it is banned in the lands occupied in 1948 and in Jerusalem by law, which is called Nakba law, where the Nakba law says that every institution that commemorates Nakba will be banned of state financial resources, and this applies to schools and psychological services. And if the case was in Jerusalem, the place would be actually targeted and closed as they did in the past several years. Palestinian kids actually who study in schools that are under the Israeli educational system are obligated are banned actually to commemorate Nakba and obligated to study Jewish history, which is good, but actually being banned from mentioning Palestine, like their own narrative and their own selves. So you are actually being banned of expressing and being your own self while learning the story and the narrative of others. While in core of educational psychology practices, we study that human need of being part of a whole, of a collective in achieving self-fulfillment and competency is main. And this is, as Desi and Ryan pointed in their study. We also learn about the need of meaning in life, in finding a meaning, and in our individual and collective narrative, and how this meaning keep us alive, as Viktor Frankl pointed. So this is why we are asked as psychological providers to integrate the narrative of the Jewish Israeli narrative in the services we provide. And he raises the question, what about the Palestinian human? Are we human enough to consider our right to express and live our own narrative? Well, there is no expectation from a colonial regime to see it, but we Palestinian and international professionals, what can we do about it? So this was what I had to say today. Thank you.
Thank you so much, Asrar. That was absolutely just so fascinating. I would love to know, can you tell me sort of, I imagine everything it depends on what's happening, but can you tell us sort of what your typical day is like in your work, typical week? I totally understand that this is not a typical week, but would love to know about that.
So yeah, there's a difference between a typical week and this week. While in typical week, I'm actually facing a daily pressure while facing and perceiving such information from families and from kids, facing this appearance maybe or not being sure about their own narrative, while I know and deeply appreciate and deeply believe a narrative as a way of living healthy life and healthy like psychological well-being. And while I saying this at work, this really stresses, and I get back to my colleagues and we discuss it again and again and again. So, and what can we do with it? But inside the Israeli educational psychological services, we cannot, like inside this system, we cannot actually and officially do things. Sorry for that. But what can we do is volunteering and providing a volunteer work like after work or at another time, or by writing critical research, which I would like and love to do. But this week actually was a bit different. These 2 weeks. These 2 weeks are full of kids, teenagers, and young people arrested while praying, while inside the Aqsa mosques, where bombing were like these tear gas bombing were falling, and then the soldiers just each night were coming, like at Ramadan month, which is like sacred for Muslims, were attacking, and then kids were actually by this bombing and the cruelly entrance and invading was actually separated from their families. You can see like some kids stuck inside the dumped rock, and others are, and their parents stuck outside, or the opposite. And you can see and hear all the time people, mothers with the panic attacks trying to call or know where are their children now, or the children, like last Monday, there was this kid who just went there with his friends and the family, where their family stayed outside, but he felt a bit calm when he found like his three friends around him. And when the second bombing and the soldiers tried to enter the dome of the rock, small kids were really freaked out and starts to yell. That's when he couldn't find his third friend, and he just started crying hard. When his friend appeared, he just hugged him very hard, and then he looked at his face and just dropped him away. Yani, where did you go? He tried to just yell at him and be angry at him, because he couldn't bear this fact that he could have actually not see him again, or just lose him. So in several cases, this was really hard. I guess that Samiha asked me something and I couldn't
Yeah,
read
I
it.
can relate to you.
Yeah.
You were already touching on it. I mean, it's just heartbreaking, the things that the children are having to go through and the emotions they're feeling are for most of us adults. We've got Mohammed, who's joined us. His camera's off, but Asrar, he's here in case you want any translations, so just say. But we've got a question from Samiha. Asrar, you have told me that you have been supporting children and their families the last few days during the recent current events in Jerusalem. Would you be able to tell us a little bit more about this?
This actually started in Jerusalem, but now it is provided in several places in historical Palestine, actually, in the lands occupied in 1948 and in Jerusalem. But we couldn't be also in the West Bank or Gaza. What happened is that many arrestments were like being at inside the old city and outside the old city of Jerusalem, and people were stuck for hours outside the police stations, while the police tries all the time to make children and their families feel like alone, that their naughty kid has done this individualistic naughty act, and he should be really punished about it. And they actually send most of these children to be home detained, or home, I don't know if I'm using the correct term, but be like home jailed. And in this case, they are asking the parents to pay high price of bill, and then one of them should be sitting inside the house and leaving his work and just sitting with this arrested house arrested kid. So many things contradict in this relationship between parents and kids. Actually, for the kid, his parents are the source of support and the source of providing this not only handling, but also this understanding of feelings and helping to contain this experience and digest it. And all of a sudden, the people are the relations between kids and their families are now the opposite. The parents are now in a place of somehow blaming these kids for making them now acting like paying money that they couldn't bear, or just sitting at home instead of working, and by this losing money. And actually, as the police tries to let them know their individualistic irresponsible act. So what we try to do, we could face in the streets, outside the police stations, parents that were really angry about the situation, about their kids, and about what is happening, and others were really like understanding and the situation. And it depends, like if they had previous experience in that or not. So what we do is to provide the parents psychological first aid if they were shocked by the arrestment, or having like really afraid about their kids, because the police in the first hours are just preventing, which is illegal, but are preventing the lawyers to get to the detainees and the arrested. And that way we cannot know, and the parents cannot know where the children are in these few hours. So we are accompanying these parents and these families when trying to actually hear their narrative and try to actually relook and rethink to this narrative. Is this kid is really irresponsible, or he couldn't feel and couldn't stay irresponsible about the injustice that is happening. So this actually can, and actually for the parents to feel that they are not alone, and that we are all like one people that will support and help each other. So this, we felt that this was really helping in the few first days. And now when this situation is now moved, and not moved, but is actually copied and being repeated in the different villages and the lands occupied in 1948. So we have several and different groups of psychologists, volunteers, and the social workers. And we all volunteer to accompany these parents and kids after being released to home detention. So this is the kind of, some of the kids were out of the, sorry for keeping long, but this is an important information. Some of the kids in Haifa area, in the north of lands occupied in 1948, were out of the investigation with panic attacks. And one kid was just, I don't know if this is the right word, but was actually dizzy and puking. And I can tell that this is can be due to two things or three, but I know two of them. One of that may actually be a panic attack after being facing panic attack for several times, or if they may had used with him this shaking technique. It is a banned, actually should be banned internationally, investigation technique. And when they do it very hard to a child, this will make him actually afterwards feel dizzy and puke. And this is in the really easiest cases. In some cases it causes brain damage, so that is why it should be banned, actually, or banned by international law.
Thank you, Isra. It's very, very informative and very great experience, and thank you for this. Just my short question because of the time. How the Israeli authorities respond to your help and to your activities? They are allow you to do what the way you are explaining the activities. They allow you to do this. What is the challenge you are facing when you are trying to help these children?
They do not they do not know actually till now about this about these activities, because this is not part of our official work as an employees for the psychological services, because we are banned to do that there. This is a volunteer thing that we do, like and we are actually great people. And I have like a really large list of volunteers, psychological and social workers that are really want to just give and help people. So we do it voluntarily. We face the difficulty of the of code of ethics and the whole documentation issue and so. But what we try to do is not providing a psychological therapy. So this code of ethics thing wouldn't really apply for us. We are doing a collective and community support. Like, we are Palestinians, we are professionals, but we are Palestinians. So we are practicing our whole and our collectiveness, supporting each other, but with the thoughts and the eyes and this maybe in the ear of psychologists and for social worker that can actually give this first psychological aid or this support conversation to the family, or in sometimes a psychoeducational support about panic attacks, about the relations in time of home detention, house detention.
Thanks for that, Asrar.